So today we will be discussing about the epidemiology, prevention and control of diarrhea. Diarrheal diseases. Diarrhea is ranked second after ARI as a leading cause of child deaths, 80% of which occur in the first 2 years of life. Diarrhea is defined as an intestinal disorder characterized by abnormal motility and fluidity of fecal evacuations. It is the passage of loose or watery stools more than thrice in a 24-hour period. Breastfed infants pass soft semi-solid stools, and hence the change in consistency and character of stools is more important in diagnosis. Clinical types of diarrhea. 4 clinical types of diarrhea are recognized. They are acute watery diarrhea. This involves passage of loose watery stools without visible blood. Vomiting and fever may be present. Duration is less than 14 days. Acute watery diarrhea results in dehydration and undernutrition when food intake is reduced. Common agents causing acute watery diarrhea are rotavirus, E.coli, shigella, cholera, 01, salmonella. Clinical types of diarrhea. Another type is acute bloody diarrhea. Involves diarrhea with visible blood in faces. Complications: anorexia, rapid weight loss, sepsis, damage to intestinal mucosa. Agents are campylobacter, jejuni, shigella. Third type is persistent diarrhea. This type begins acutely as watery or bloody diarrhea. Duration lasts 14 days or longer. Complications: marked weight loss and risk of dehydration. Agents: no single microbe is responsible. Cryptosporia may play a greater role. Chronic diarrhea refers to recurrent or long-lasting diarrhea due to non-infective causes like gluten insensitivity and should not be confused with persistent diarrhea. So, chronic diarrhea it is recurrent diarrhea, while persistent diarrhea is it persists for 14 days or longer continuously. There is no disappearance in persistent diarrhea. but in chronic diarrhea, diarrhea may disappear and again it will appear, and it will the duration is not defined for this. Okay, diarrhea can be diarrhea with severe malnutrition. Diarrhea can be associated with states like marasmus and kwashiorkor. Kwashiorkor and marasmus, these both are included under protein energy malnutrition, and these are the major cause of economic burden in the developing countries like India and some other African countries. So, what are the causes of malnutrition in diarrhea? Nutrient intake declines by as much as 1/3 during the first few days. Loss of nutrients due to diarrhea, vomiting. Nutrient absorption is decreased. Complications: severe systemic infections, dehydration, deficiency states, heart failure. Heart failure because due to dehydration, the decreased blood pressure, and so decreased cardiac output will also be there because of heart failure, and so you will see other systemic adverse effects in the body. It may also lead to renal failure sometimes, and eventually it will lead to death, mostly in children, because and it is not only limited to children, but it can also happen in adults. Okay, so other clinical types of diarrhea. Persistent diarrhea. This type begins acutely as watery or bloody diarrhea. Duration lasts. Okay, we have discussed this. So the vicious cycle. Predisposition. A small intestinal dysfunction. This will lead to chronic diarrhea, and hence the malnutrition. And malnutrition, pancreatic and gastric dysfunction. Malnutrition lead to pancreatic and gastric dysfunction, and it will also lead to specific deficiencies like zinc, iron, etc., and other micronutrients and macronutrients. And due to deficiency of these nutrients, this will lead to immune deficiency, and due to immune deficiency you will see the bacterial sepsis, which mostly E. coli and some other bacteria, which will uh, which are the causes of causing diarrhea, and again this diarrhea will lead to malnutrition. And due to immune deficiency, due to defective absorption of uh, elements like zinc, which are involved in providing immunity to the body, so the immune deficiency will lead to small intestinal dysfunction, because pathogen will grow, they won't be killed by our immune system, and again intestinal dysfunction will lead to diarrhea due to these reasons. So, what are the causes of diarrhea? Acute diarrhea is caused by bacteria, campylobacter jejuni, V. cholerae, shigella, E.coli, salmonella, and viral causes are rotavirus, astrovirus, adenovirus, enteric viruses, norwalk group of viruses, parasitic infections are also etiology of diarrhea. These parasites are Giardia, E. histolytica, Cryptosporidium, intestinal worms. Common intestinal worms include helminthics. Tapeworm and some other worms. Toxins which also cause diarrhea are a staphylococcal toxin. Staphylococci release these toxins. Bacillus cereus, salmonella, and these toxins are important in causing food poisoning also, which I'll tell you later, which bacteria and other agents cause food poisoning. And chronic diarrhea. So infective etiology of chronic diarrhea, infective parasites, worm and amoeba, salmonella. Non-infective, these are malabsorption states like celiac disease, lactose intolerance, fructose malabsorption, and others like radiation fibrosis. Chronic inflammatory diseases like ulcerative colitis, Crohn's disease, and some other etiologies include ischemic bowel disease, cancer of large colon. Pathophysiology of diarrhea. The amount of fluid present in the bowel is around 6 to 9 liters combined with secretions into bowel, but most of it reabsorbed. A stool contains 100 to 200 milliliter per day. Any increase is diarrhea. Complications are due to loss of water and salts in stools, which is dehydration. Fluid is lost from bloodstream. Heart compensates by beating faster. Fluid is drawn. This is homeostasis. Fluid is drawn from body tissues and circulation to essential areas closed down. Limbs become cold and pulse is weak. Circulation collapses. Urine volume decreases. Consciousness is impaired. In cholera acid-base balance is disturbed and acidosis occurs. Fluid into and cut out of the adult element. Yeah, video is going long, so let me just finish it fast. I will discuss some importance. Pathophysiology. These are secretory diarrhea caused by E.coli. ETC toxins are released and stimulate enzyme adenylactulase. This stimulates outpouring of sodium and chloride ions with water as long as the cell lives, causing watery diarrhea, leading to dehydration, see collapse, and cardiac failure. Invasive diarrhea. Here the pathogens colonize and invade the mucus. The cells die, blood vessels rupture, white cells along with blood and tissue fluid are excreted. Dysentery seen in shigellosis. The rotavirus functions in both ways. Clinical features. During diarrhea, increase in loss of water and electrolytes is seen. If not replaced, it results in dehydration and associated symptoms. Volume of fluid lost in stools 5 milliliter per kg to 200 milliliter per kilogram in 24 hours. Loss of electrolytes, sodium 70 to 110 millimole per liter of water deficit. Potassium and chloride losses are similar. Dehydration occurs easily in infants, elderly people, and patients with fever. Grading of diarrhea. Degree of dehydration indicates amount of fluid loss. Early or mild dehydration, extreme thirst, decreased urine output, weakness, cramps, irritability, warm dry skin, crying with few or no tears, dizziness, dry mouth and tongue. Moderate to severe dehydration, low blood pressure, sunken fontanelle, and dry eyes, wrinkled inelastic skin, rapid and deep breathing, fast, weak pulse, severe dehydration. Effects are more pronounced, hypovolemic shock, and eventually death may also occur. Assessment of dehydration. The table below can be used to assess whether a patient is dehydrated or not. Some dehydration or severe dehydration can be diagnosed if the patient has two or more signs in the appropriate column. In the case of some dehydration or severe dehydration, this should include at least one of the signs in the colored box. Assessment of diarrhea, patient for dehydration. Condition. In no dehydration, patient is well and alert. While in some dehydration, patient will feel restlessness and patient is irritable. And in case of severe dehydration, the patient is lethargic or unconscious even, and floppy, and eyes are normal in no dehydration, while in some dehydration eyes are sunken, and in severe dehydration very sunken, eye will be very much sunken, and it will be dry, and tears will be present in no dehydration, while it will be absent in both some and severe dehydrations. Mouth and tongue will be moist in no dehydration, while in some and severe dehydrations, mouth and tongue will be dry and very much dry respectively. Thirst. Person will drink normally and will not be so will not be thirsty in case of no dehydration, while in the case of some and severe dehydration, uh, the patient will be thirsty and drinks eagerly and drinks poorly or not able to drink even in case respectively. So in case of some dehydration, patient will be thirsty and drinks eagerly more and more. But in case of severe dehydration, patient will even not be able to drink water. Patient because patient might have gone in unconscious state, or if conscious, then patient will poorly drinking. Okay, a skin pinch in case of no dehydration goes back quickly, so skin will be elastic and it won't be shrunken, while in case of dehydration uh, elasticity will be reduced, and while in case of severe dehydration it becomes plastic physically, and because it goes back very slowly, not plastic, but it has lost its tensile uh, elasticity very much. Means elasticity is very much reduced and skin becomes shrink because of severe dehydration. So if you see any if you see two condition uh, probably stable in any patient, then you can conclude that the patient is having dehydration. Okay, so a serious dehydrated child is depicted in this photograph. Here what you are seeing here, that you can just notice eyes. This is how it is. See, eye is very shrunken, very much shrunken. Even it looks like the child has closed uh, his eyes. So it looks like that. It is because, and even if the child will be crying at that time, then you are not seeing any tear. So, and fontanelle is appearing shrunken, but other is, yeah, skin you can see here below in the chest region, just in the armpit region, you can see this is what shrunken skin is there, and it looks like it has um, lost too much of its elasticity. So okay, running baby can make running belly can make your baby dry up. Watch for these signs. So, sunken mode, mouth is dry, sunken eyes, loss of water from skin makes it stand up, and your baby stop playing, and watery stool will also be there. If you see any of them, take your baby at once to the nearest health center or hospital, and or if you want to prevent these things to happen to your baby, I'll tell you uh, some preventive measures are there, such as making ORS, and I'll discuss that thing later. So keep watching it. Viral gastroenter uh, gastroenteritis. Rotavirus is the most important cause of severe and life-threatening in child under 2 years of age worldwide. Nearly all children are infected once before age of 2 years, and repeated infections are common. Spread is from person to person. Pathogenesis. Virus particles replicate in villi, epithelium of a small bowel, causing villi destruction, loss of villi, and replacement with immature epithelium causes secretion of water and electrolytes. Loss of disaccharidase enzyme leads to reduced absorption of dietary disaccharides. Uh, Recovery occurs when regenerated epithelium matures. It is more severe compared to other viruses. So this rotavirus. Okay. Adenovirus. Another virus apart from rotavirus, adenovirus will also cause gastroenteritis. Enteritis, gastroenteritis, rotavirus, adenovirus. Several outbreaks have been associated with in children. It causes severe infection in children. Coronavirus. It has been reported in feces in Vellore, India. It might be causative for diarrhea associated with malnourishment. So coronavirus can also be the cause of viral gastroenteritis and leading to dehydration. So dehydration might also be one of the causes of, apart from cardiac or renal failures, It might also be the cause of the death in the COVID patient. Other viruses include viruses of norwalk group are a common cause, but infection in mild mortality is very less. Other enteric viruses like gastro and caliciviruses are less common. These are some reports. Bacterial causes of diarrhea. Mechanism of action: mucosal adhesion seen in ETEC v. cholerae 1. Toxins that cause secretions seen in ETEC v. cholera 1. Salmonella. Mucosal invasion seen in shigella, campylobacter jejuni, E.coli. Clinical features of bacterial diarrhea. Copious watery diarrhea seen. EPEC. Fever, abdominal cramps, tenesmus and watery diarrhea. EIAC. It is sudden diarrhea, like when prolonged, it has high mortality in children. Cholera, mostly caused by E.coli. It has 3 stages: a stage of evaluation, a stage of collapse, and the stage of recovery. A stage of evacuation, okay, collapse and recovery. So these are some bacilli. Clinical features of bacterial diarrhea. Shigella. Shigella flexneri is the most common, but Shigella dysentery type 1, which causes regional epidemic, is most severe. Clinical features of shigellosis. Watery diarrhea, a stool mucus, a stool blood, abdominal pain, vomiting, fever. Clinical features of bacterial diarrhea. Campylobacter jejuni. In developing countries, Campylobacter jejuni causes disease in infants. It can cause both watery diarrhea, 2/3 cases. So watery diarrhea is most common type of diarrhea, or dysentery, 1/3 cases. Fever may be present. Disease is not severe and lasts 2 to 3 days. So Campylobacter jejuni. Okay. Yersinia causes gastroenteritis in children in Canada, Europe and Japan. It is a surgical emergency. Yersinia pestis. Salmonella. It causes invasive diarrhea like shigella. Only 10 swallowed bacteria are enough to cause it. So it is shigella, salmonella is very much effective bacterial agent to cause diarrhea. So only 10 swollen bacteria due to food poisoning or anything. If you are taking only 10 salmonella, it is sufficient to cause diarrhea. Symptoms like campylobacter, like but it may disappear in 2 to 3 days. Diarrhea due to protozoa. Cryptospordia. This parasite is an important opportunistic agent causing chronic emaciating fetal diarrhea and fetal diarrhea. It might infect children and adults and infants. It causes self-limiting watery diarrhea and weight loss. Dehydration, malnutrition may occur if untreated. It is not as severe or as important as bacterial or viral diarrheas. So, cryptospordia. This is this one called severe diarrhea, like what bacteria and viruses do. Giardia duodenalis, usually found in duodenum. And cryptosporidea. Troublous diarrhea. Etiology of troublous diarrhea. Diarrhea and AIDS. Hospital acquired diarrhea. Food poisoning. Definition: an acute gastroenteritis caused by invasion of food or drink contaminated with live bacteria or their toxins, inorganic chemicals, poisons. Bacterial causes these food poisoning are salmonella, staphylococci, both linum, Clostridium perfringens, Bacillus cereus, except salmonella and other released toxins. Here, how you this is the how you examine the stool of the pest and the presence of these organisms. This is bacterial culture. Laboratory diagnosis. So, laboratory service. So, here you can diagnose the presence of which type of bacteria is present. Laboratory diagnosis. Laboratory services are available at primary health care center level, intermediate referral level, district hospital, central level, collection of a stool specimen. Specimens are collected as soon as possible before administration of antibiotics into a clean, leak-proof bottle. Contamination with urine should be avoided. The presence of blood, mucus, worms and tapeworms segments should be noted. Tapeworm, hookworm and other worms are also there. Can be noted while examining the stool of the patient. And laboratory diagnosis. Collection of water specimen. 1 to 3 liter of suspected water is collected in sterile bottles by filter method and quickly sent for analysis, useful in cholera. Collection of food samples. Suspected food 1 to 3 gram is collected and sent for analysis. So if there is poor you should hygienic food and water should be taken, and also your excreta will be managed well at home or wherever you are staying, and avoid taking contaminated food from. So I will just discuss all those things. In laboratory diagnosis, transportation, saturate or carrier media are used when there is a delay in reaching the laboratory. All enteric bacterial pathogens survive in carrier medium for up to 2 days. Phosphate buffered saline is used for rotavirus. The specimen 0.5 to 1 gram of a stool or 2 milliliter fluid is transported in the medium in a Bijou bottle. More than one sample should be collected. Examination. The following are observed. Macroscopic appearance. Microscopic appearance. Saline preparation is done for protozoa and worms. amoebic and bacillary dysentery, each differentiated using methylene blue stain. Hanging drop preparation is useful for cholera only when dark ground illumination microscope is present. Enteropathogenic bacteria can be demonstrated in feces directly or in culture by using McConkey's medium and others. Biochemical tests can also be done. Components of diarrheal diseases control program. These can be classified as short-term and long-term. Short-term measures for controlling diarrhea. Appropriate clinical management, oral rehydration therapy, home-made solution, oral rehydration solution, etc. Oral rehydration therapy (ORT) is the cheap, simple, and effective way to treat dehydration caused by diarrhea. Most often, diarrhea kills a child by dehydration, which means that too much liquid has been drained out of the child's body. At the causes I have already done. I have already uh, discussed. So as soon as diarrhea starts, it is essential to give. I have already told you how loss of fluid occurs through body. So it is essential to give the child extra drinks to replace the liquid being lost. Comparative accessibility of different methods of therapy. Intravenous in case of severe diarrhea. ORS in case of severe and mild or some diarrhea, mild or moderate or some diarrhea. And homemade solutions like oral rehydration, uh, like ORS. Well, it's 8 teaspoons of sugar, 1 teaspoon of salt, and 1 liter of water. Just this much. You should also note that you should not take more than 1 teaspoon of salt in 24 hours. Types of ORS. Composition of ORS: bicarbonate, composition of ORS citrate. The inclusion of trisodium citrate in place of sodium bicarbonate has made the product more stable. It also results in less stool output direct direct effect of trisodium citrate in increasing intestinal absorption for sodium and water. Composition of the oral rehydration salt. So here this is the method how you prepare the oral rehydration salt. So take 8 teaspoons of sugar and mix it with 1 liter of water and 1 teaspoon of salt. Not 1 teaspoon of salt. So it is very effective. It will this oral rehydration salt is effective uh, element effective material to enhance the absorption, so stool output will also be decreased. So composition, let me just, so ingredients, solution recommended by World Health Organization. So these are the composition of the oral rehydration salt. So ingredients: sodium chloride grams, 3.5 grams per liter of water. Okay, and sodium bicarbonate 2.5 grams per liter of water. Potassium chloride KCl 1.5 gram per liter. Glucose 20 grams per liter. Or in millimole per liter of water. Sodium 90 millimole. Potassium uh, per liter. Potassium 20 millimole, chloride 80 millimole, bicarbonate 30 millimole, and glucose 111 millimole per liter of water. So these are the ingredients. Sodium chloride, NaCl, so salt. Uh, how salt already contains sodium chloride, sodium bicarbonate, and potassium chloride, and when you are adding sugar, so it contains sucrose, and when disaccharide enzyme will be there, it will be converted into glucose in your body. So but in severe dehydration, disaccharide enzyme is not there in body, so you will have to add glucose. So glucose is also available and marketed by different countries and different name. So in case of severe dehydration, you can give glucose, but some precautions must be taken, that there is active absorption of glucose. So if person is feeling very weak, so you can't just administer glucose, because it will lead to death without giving you chance to treat. So just be okay. So complete knowledge is necessary. Without treating your patient, as a physician, you must know all these things. Otherwise, if you will doing like quacks, then what is the benefit of your degree? I have seen. So, oh no, just learning. I don't know. How. So, oral rehydration salt citrate IP. Mode of action. So this is the lumen. So first you take orally or orally this oral rehydration salt, and then their H2O, sodium ion, and glucose. These all you are taking orally, and so it will be absorbed into lumen, and from the lumen it will be absorbed into the blood vessel. So active absorption of glucose is there with the help of sodium and glucose, both are taken together, and sodium is there in the blood, so it will absorb water from the lumen also. So low blood pressure will become normal. Okay. And if patient is unconscious, but you just at that time you will have to, there are some, how much you should give the what should be the amount which is given to different patients. I'll also discuss all those things. So simply you just don't do, and it will be fatal, it will be proved fatal for your patients, so just be okay. So how does oral rehydration therapy work? Acute diarrhea normally only lasts a few days. Oral rehydration therapy does not stop the diarrhea, but it replaces the lost fluids and essential salts, thus preventing or treating dehydration and reducing the danger. The glucose contained in oral rehydration salt solution enables the intestine to absorb the fluid and the salts more efficiently. Oral rehydration therapy alone is an effective treatment for 90 to 95% of patients suffering from acute watery diarrhea, regardless of the cause. So, acute watery diarrhea, it should not be chronic, because again chronic will be due to bacterial or viral sepsis or some parasitic or protozoans. So their oral rehydration salt is not effective, but 90 to 95% of cases in cases of acute watery diarrhea, it is sufficient. Assessment of dehydration. How will you assess the your patient whether he or she is dehydrated or not? When obvious signs of dehydration exist, just refer to those table. Refer to this table for assessment. I think yeah, this table. Just refer for the assessment of dehydration, which I have already taken. See eyes, tears, mouth, tongue, thrust, skin, pinch, skin condition, all these things you will see. In case of severe dehydration, uh, patient will be lethargic and unconscious, floppy, and eyes will be very sunken and dry, because tears you will not see when the patient will cry, and okay, and dry tongue and mouth will be there, and patient will drink very poorly, or even will not be able to drink, and the elasticity of skin is too much reduced. Okay, so this table you should refer. Okay, so we were discussing here. uh, so when obvious signs, refer that table of dehydration exists. So the water deficient is somewhere between 50 to 100 milliliter per kilogram of body weight. If child weight is known amount of oral dehydration salt in, if first 4 hours is 75 milliliter per kg body weight. So if your child is 20 kg weight, uh, so how much amount you will give? You will give 1500 milliliter of ORS. So depending upon the weight of the body of the child, but this is for your child only, because again, yeah, because child has efficient liver and other things, but in elderly patients you can't do like this. Uh, okay, so yeah, here you can see different things, different. So weight in kilogram of body and ORS in milliliter. How much amount you will give? So this is like this. So for less than 4 months of age, if and less than 5 kilogram of body weight, 200 to 400 milliliter of oral rehydration salts can be given. For 4 to 11 months of age of your baby and body weight between 5 to 7.9 kilograms, you can give 400 to 600 milliliters of oral rehydration salt. And for 1 to 2 years of your patient, give and body weight between 8 to 10.9 kilograms, give it 600 to 800 milliliter of oral rehydration salt. And for 2 to 4 years of age and 11 to 15.9 kilogram or less than 16 kilogram body weight, you can give 800 to 1200 milliliters of oral rehydration salt. And for 5 to 14 years of age and weight between 16 to less than 30 kilogram of body weight, give 1200 to 2200 milliliter of oral rehydration salt. And for more than 15 years of age and more than 30 years 30 kilogram of body weight, uh, you can give 22 2.2 liters to 4 liters of oral rehydration salt in first 4 hours. Prevention of preparation of oral rehydration salt solution. 1. First step: wash hands with soap and water, not alcohol based rubs, before preparing solution. Second step: put 1 liter of clean water in a clean pot. Third step: empty the contents of a packet of oral dehydration salt into the water while stirring. Fourth step: give the sick child as much of the solution it needs in small amounts frequently. Small amounts. Mode of administration. For children under years, give a teaspoon every 1 to 2 minutes or offer frequent sips. For older children, adults may drink as much, but not more than 4 liters a day. Give the estimated amount within 4-hour period. If the child vomits within 10 minutes, then give the solution slowly, a teaspoonful every 2 to 3 minutes. If the child wants to drink more oral rehydration salt and does not vomit, there is no harm. Rehydration is but don't give more than what given in that table for first 4 hours. Rehydration is completed if child refuses to drink and signs have disappeared. If child is breastfed, nourishing should be nursing should be pursued with oral rehydration salt solution. Non-breast under 6 months give additional 100 to 200 milliliter of cleaned water. Intravenous rehydration indications: high rate of purging, more than 12 milliliter per kg per hour. Persistent vomiting, more than 3 vomits per hour. Severe dehydration and shock. So if you are seeing all these things, then intravenous rehydration is required for that patient. Hypovolemic shock can lead to death. So here intravenous rehydration is required, and if persistent vomiting is there, then oral rehydration salt is not sufficient as a treatment for the dehydration. So more than 3 vomits per hour, if you see in the patient, it is under the so you can start intravenous dehydration for that patient. And if more than 15 milliliter per kilogram of body weight per hour each volume is, body fluid is lost, then again intravenous dehydration is required, because again in these cases the absorption is decreased, so oral rehydration salt therapy is not sufficient for treating. Otherwise it will lead if it will remain untreated, then it will lead to hypovolemic shock. So it will lead to severe dehydration and hypovolemic shock, and eventually death. So okay, solutions recommended are ringer lactate solution, diarrhea treatment solution, and doses. Recommended dose is 100 milliliter per kilogram in divided doses. So again, maintenance therapy. After initial deficit corrected, this is followed. Mild diarrhea 100 ml per kilogram per day, severe diarrhea 10 to 15 ml per kilogram per hour. Maintenance therapy. After initial deficit corrected, this is followed. In case of mild diarrhea, 100 ml per kg per day, and in case of severe diarrhea, 10 to 15 ml per kg per hour. Just I want to tell you that how will you prepare the ringer lactate solution. So ringer lactate solution is best available commercial solution and supplies sodium, potassium and lactate. So ringer lactate solution can also be given post surgical procedures, and in case of severe dehydration, if you are treating the patient, it can be given intravenously. Okay, and diarrhea treatment solution include ideal polyelectrolyte solution. So sodium chloride 4 grams, sodium acetate 6.5 grams, potassium chloride 1 gram, glucose 10 grams in 1 liter. Appropriate feeding. During the episodes of diarrhea, normal food intake should be prompted. Newborn infants with diarrhea who shows little or no signs of dehydration can be treated by breastfeeding alone. Moderate or severe dehydration should receive oral rehydration salt alone during rehydration phase. Once the infant is rehydrated, breastfeeding is continued alone with oral rehydration salt given after each stool. Chemotherapy. Unnecessary prescription of antibiotics and other drugs cause damage of gut mucosa. Example: neomycin damages the intestinal mucosa and causes malabsorption. Tincture of opium or atropine is dangerous for children and dysentery because of decreased intestinal transit time. Better MCH services. Maternal nutrition and child nutrition. Maternal nutrition. Improved prenatal nutrition will reduce low birth rate problem. Prenatal and postnatal nutrition will improve the quality of breast milk. Child nutrition. Promotion of so in case of so maternal nutrition should also be cared. Should also be taken care uh, in prenatal period as well as in postnatal period. because in prenatal period it will lead to development of good fetus inside the uterus of woman, and so development will be well in case of if uh, before prenatal the woman age uh, has been supplemented with good nutrition, and in postnatal nutrition it is important because she will be feeding her baby, and baby will be getting the complete food through the breast milk. So newborn, for newborn it is very important that milk should be highly nutritious for the baby, so mother should be given proper nutrition. Okay, so child nutrition, promotion of breastfeeding, approved appropriate weaning practices, and supplementary feeding. So promotion of breastfeeding, the breastfed child is at very much low risk of diarrhea and death than the bottle fed infants. Exclusive breastfeeding for 6 months is required. Limit the use of bottle fed and commercial preparations for the child. Okay. Appropriate weaning practices. The child should be weaned neither too soon nor too late in any case. Not later than 6 months of life using nutritious and locally available foods. So, and should be hygienically prepared. So, when you start feeding your child with a commercial available solution, so the weaning practice should be started uh, just after completing 6 months of the baby. So child and after 6 months you can child can stop so you can stop breastfeeding for that child. Okay, and supplementary feeding, uh, this is to improve nutritional status of the child. So in supplementary feeding, what all will you give to your baby? You will be giving um, some easily digestible, easily absorbable forms of uh, food, nutrition, and it should be highly nutritious also. So instead of giving rice, you will be giving uh, what you get from the rice, some liquid. Prepare the rice giving more water into that, and after boiling the rice you will get some water from that. That water will be having some starch, so you can give that semi-solid food to that child. Okay, so this is the supplementary feeding. So prevention of diarrhea. So what are those strategies? Sanitation, water, excreta disposal, and food. So improved water supply breaks the chain of transmission. Urban areas, water containing free residual chlorine, and in rural areas, boil the water. Excreta disposal, simple, cheap, effective excreta disposal system is a basic need for all. If there is no uh, laboratory laboratory, they should defecate at a distance of 10 meters away from the water supply. Yeah, so there should be toilets in each and every home. Food improve and yeah, in villages, food improved food sanitation cell of food under hygienic conditions breaks an important vehicle. Disinfectants like coal tar with radial radial Walker coefficient of 10 or more should be used for disinfection of stools, vomits, and personal items. Patients are to be followed. Personal hygiene. Simple measures like hand washing with soap and water, or alcohol rub best before preparing food, and before eating food, and after defecation. So it is just you just simply maintain your hand hygiene. Wash your hand with soap and water. Just you need not wash your hand with alcohol based rub. So but hand hygiene is very important nowadays in the COVID-19 times. So you should wash your hand with alcohol rub, and also here um, water and soap is sufficient along with other things. So personal hygiene, hand hygiene is important. And okay, so fly control. Flies breeding in flies breeding in association. So flies breeding in association with human or animal feces should be controlled. Immunization against measles can be prevented up to 25% diarrhea deaths in under 5 years of age. Health education. Health worker has to initiate campaign for the community about the preventive measures. Thanks for watching. So what is this?